Hey nurses, welcome to Quick Medicals.
A nurse is preparing to insert a nasogastric tube into a client. The nurse places the client in which position for insertion? A. Right side. B. Low Fowlers. C. High Fowlers. D. Supine with the head flat. 2. A nurse develops a plan of care for a client with deep vein thrombosis. Which client position or activity in the plan will be included? A. Out of bed activities as desired. B. Bed rest with the affected extremity kept flat. C. Bed rest with elevation of the affected extremity. D. Bed rest with the affected extremity in a dependent position. 3. A client in labor is transported to the delivery room and is prepared for a cesarean delivery. The client is transferred to the delivery room table, and the nurse places the client in the A. Trendelenburg's position with the legs in stirrups. B. Semi-Fowler's position with a pillow under the knee. C. Prone position with the legs separated and elevated. D. Supine position with a wedge under the right hip. 4. A nurse is caring for a client who is 1 day post-operative for a total hip replacement. Which is the best position in which the nurse should place the client? A. Side lying on the operative side. B. On the non-operative side with the legs abducted. C. Side lying with the affected leg internally rotated. D. Side lying with the affected leg externally rotated. 5. Which of the following is the best position to increase the brain perfusion, cerebral perfusion? A. Prone. B. Supine. C. Semi-Fowlers. D. Trendelenburg's. 6. A client has a nasogastric tube after a gastric resection. The nurse should expect to observe A. Vomiting. B. Gastric distension. C. Intermittent periods of diarrhea. D. Bloody drainage for the first 12 hours. 7. When caring for a patient who is receiving total parenteral nutrition, which of the following complications would be most important for the nurse to assess? A. Chest pain. B. Hemorrhage and air embolus. C. Pneumonia and hyperglycemia. D. Electrolyte imbalance and sepsis. 8. Which of the following clinical manifestations of type 2 diabetes occurs if glucose levels are very high? A. Hyperactive. B. Blurred vision. C. Oliguria. D. Increased energy. 9. Which of the following would the nurse expect to find in a client with severe hyperthyroidism? A. Tetany. B. Buffalo hump. C. Exophthalmos. D. Striae. 10. Which of the following diet would be most appropriate for a client with chronic obstructive pulmonary disease? A. Low-fat, low-cholesterol diet. B. Bland, soft diet. C. Low-sodium diet. D. High-calorie, high-protein diet. 11. The nurse would expect to find which information when reviewing the history of a client diagnosed with multiple sclerosis? A. Visual problems. B. Increased sensitivity to pain. C. Ascending weakness and numbness. D. Confusion and disorientation. 12. A client with myasthenia gravis is suspected of having cholinergic crisis. Which of the following indicate that this crisis exists? A. Ataxia. B. Mouth sores. C. Hypotension. D. Hypertension. 13. Which of the following is the purpose of providing atropine prior to anesthesia and surgery? A. To decrease salivation, secretions. B. To increase blood pressure. C. To facilitate breathing. D. To decrease muscle tone. 14. Which of the following diet is most appropriate for a client with Cushing syndrome? A. High protein diet. B. High potassium diet. C. High calcium diet. D. High iron diet. 15. Vitamin K is prescribed for a neonate. A nurse prepares to administer the medication in which muscle site? A. Deltoid. B. Triceps. C. Vastus lateralis. D. Biceps. 16. Which of the following interventions should be taken to help an older client to prevent osteoporosis? A. Decreased dietary calcium intake. B. Increased sedentary lifestyle. C. Increased dietary protein intake. D. Encourage regular exercise. 17. An adult client is admitted with a diagnosis of left-sided congestive heart failure. Which assessment finding would most likely be present? A. Distended neck veins. B. Dyspnea. C. Hepatomegaly. D. Pitting edema. 18. When a patient vomits postoperatively, the most important nursing objective is to prevent A. Dehydration. B. Aspiration. C. Rupture of suture line. D. Metabolic alkalosis. 19. The nurse forgot to give the patient his prescribed drug. When the head nurse asked who is responsible for this, the nurse replayed, "That was my wrong." This is considered as A. Responsibility. B. Ignorance. C. Abandonment. D. Honor. 20. Which of the following is considered as a normal reflex in newborn? A. Moro reflex. B. Rooting reflex. C. Plantar reflex. D. Tonic neck reflex.